Dr. Anthony Fauci speaking with CBS News. And just when you thought that it was safe to take the mask off, the Department of Justice is looking to overturn a judge's ruling to drop mask mandates. For more, let's bring in former FDA Associate Commissioner and President of the Center for Medicine in the Public Interest, Peter Pitts. Welcome back to Wake Up America.
Thank you.
So we just heard sort of that famous sort of Fauci God complex that he tends to have. Your reaction to what he said?
Well, welcome to democracy. That's how the American government works. We're measuring the wrong things. Back in the teeth of the pandemic 2 years ago, when infection rates went up, death rates went up, hospitalization rates went up, we were in a bad place. We're dealing with a different COVID now. The symptoms are milder, the duration is shorter. Even though infection rates are going up, not a good thing, death rates, hospitalizations, serious manifestations going way, way down. We have to start measuring new things to recognize that we're not in a public health emergency anymore. I believe we can take our masks off. We need to take important precautions. We need to talk to the 30% of Americans who have not yet been fully vaccinated. But telling people to put their masks back on is not only bad politics, but it's bad science.
But with respect to the vaccine, is it time to also kind of go to risk stratification? There's a story out of New York where they're talking about firing cops. I mean, in New York City, at the worst possible time, over the vaccine. And we know that it doesn't prevent transmission or infection. So for healthier people, do we really need to be focusing even on the vaccine as much because of what you're talking about?
Well, the message has to change. I mean, clearly we want to get as many people vaccinated as we can. But I think right now, certainly here in New York, firing cops and laying off firemen
and doctors
is it's just the wrong way to go. We've got to figure out that if we want to bring our society back together, we've got to listen. That was then, this is now. Let's understand what the right thing to do is and work together to get there rather than being punitive.
It seems to me that a lot of Americans have sort of figured out, or at least they feel, that the CDC and the NIH have a tremendous amount of power in this country. And nobody elected any of those folks. That the public health complex has really sort of run amok here. Talk to us a little bit about the proper role of the CDC, because Dr. Fauci is saying, well, we're sort of extrajudicial. We're above and beyond the Constitution or the processes of government, because what we say is science, what we say goes. Talk to us about that.
Well, welcome to science. Science evolves, science changes. And when you hear public health officials saying do this or else, people simply stop listening. That's why Tony Fauci, regardless of how you feel about his science, needs to stop being the spokesperson. The people in our country have stopped listening to Tony Fauci. If you're not vaccinated, you clearly don't trust him or like him. It's time to replace him with somebody else. You can't allow unelected public health career officials to tell you what to do. They've got to be part of the process, but they can't lead the process. That's why we have political leaders that we elect.
Yeah. I wanted to pivot for a second here. And, we talk a lot about wokeism sort of infecting a lot of our institutions, whether it's whether education or media, big tech. But it's also impacting the doctor's office. And we're starting to hear a lot about race-based preferences for medical treatment. And that medical boards are actually getting behind this. You run an organization that is supposed to protect public health, protect the public interest. Your thoughts on some of the stuff that we're hearing out of the medical societies about sort of CRT in the doctor's office?
Yeah. It's the right place to have a conversation, but it's the wrong conversation. If we've learned nothing else from COVID-19, that you've got to protect those most at risk. And communities of color, for example, are at higher risk. But we took no time at all talking to those communities, explaining to them how to do things better, precautions to take. So, trying to have race-based medicine versus educating people as the right thing to do, it seems to me a no-brainer as to which side you come down on.
Let's talk about the media is starting to talk about these new cases again, and they're talking about variants. What do we know about the current variant? How many variants, for instance, have there been? My point of view has always been it's a virus. It's going to continue to mutate. There will ultimately be hundreds of these variants, and we will be in an endemic situation if we're not already there. Your thoughts on that?
We are in an endemic situation right now. What does that mean? It means that we won. It means that COVID-19 is going to be with us for a long time, just like the annual flu. We're going to be able to treat it annually, just like we do the annual flu. Deaths and hospitalizations are going to be very low. Infection rates become interesting, but not essential. And if we continue to think about COVID as a pandemic, as a death threat, We can't move forward. We're scaring ourselves. We're winning. We've got to pat ourselves on the back, and as one of our rewards, take our masks off.
And just when it comes to kids too, just 30 seconds for you. I was out and about this weekend. I see parents continuing to have their kids wear masks, wear them inappropriately, wear cloth masks. Are we doing damage at this point psychologically to those children, unless they are very high risk and they know that they are very high risk?
Kids are little virus incubators. They always have been. Anybody who's a teacher or has kids recognizes that. We've got to move forward. If your kids can get vaccinated, they probably should. The damage going forward relative to masks and kind of safety theater remains to be seen. If we stick with the science, we're in a better place.
All right, we got to leave it there. I want to thank you so much for joining us today, Peter Pitts. Plenty more still to come here on Wake Up America. Don't go anywhere.